This is Meg Cashman, and I looked into the health trends between our three reports. Mental health was a big one that stood out. 15% of Canadian children are affected by mental illness. ADHD and anxiety are the two most common types. Despite being so common, less than a quarter of children will receive treatment for them. Mental health issues in Canadian youth are similar to those affecting other age groups. Eating disorder and suicidal behaviors are seen most often in this age group. The mental health of Canadian seniors can be linked to the deterioration of their health. Seniors suffer greater isolation and loneliness due to their decreased mobility. Obesity is the other health trend we noticed. According to Stats Canada in 2011, 6.3% of children aged 2 to 5 are obese. 8.6% of Canadians aged 6 to 17 are obese. These rates have drastically increased in the age group of 12 to 17, which have tripled from 3% in 1978-79 to 9.4% in 2004. The elderly population, the rates have also doubled from 1981 to 2009. In 1978-79, Class 3 obesity made up only 0.9% of the population, but in 2004, Class 3 obesity made up 2.7% of the population. Studies have shown that the increased consumption of fast food and the decreased consumption of fruits and vegetables have linked to this. 36% of kids who are overweight or obese watch more than 2 hours of TV per day.
Barriers for improving mental health among Canadians can be broken down into two major categories. Firstly, we see poorly developed care pathways, poorly informed families who don't know their treatment and follow-up options, inexperienced or undertrained staff at mental health facilities, and geographical and transportational barriers. These are all examples of program and policy issues. When looking at other barriers, we see social determinants of health. Examples of this are learning disabilities, whether or not you have a foster home or live with your biological parents, poverty, which is a recurring theme, as well as gender-based roles. Barriers when it comes to assessing child obesity include a lack of correlated and organized data regarding childhood diets. As well, other program and policy barriers include a slow legislative process that fails to respond to trends of childhood obesity. Poverty, such as the fact that in 2011, 3.2 million families were living with a median household income of $14,400, is just one example of social determinants of health leading to obesity. Other SDHs include public perception and parental obesity.
This is Tamika DeCare, and I'll be talking about societal drivers to mental health. The four that I will be discussing are education, community support, and increased awareness. So for education, Better Beginnings, Better Future was a project initiated in 1991 that follows a comprehensive community-based model of primary prevention for families with young children in 8 high-risk communities in Ontario. The goal was to promote optimal social, emotional, physical, behavioral, and cognitive development, strengthen communities to the social and economic needs of the children and families, reduce serious long-term and behavioral problems. Community supports community-based prevention programs that work directly with families and children to develop protective factors that build resilience have some notable success. 3 areas that have shown to be positively influenced children in their future to manage successful situations. Individual factors, which is comprised of learning capacity, self-esteem, adaptive skills, social skills, and overall physical health. Family factors, being a part of a family. Community factors, having a sense of belonging and inclusion. Support, there are many support systems out there. A few listed are Bell Let's Talk, crisis hotlines, mental health helplines, and support groups. And we need to increase awareness by social connectedness, addressing social isolation, volunteering, and addressing ageism. The Canadian Physical Activity Levels of Children and Youth Study was performed to increase physical activity from 9% to 16% and increase number of steps walked from 11,500 to 14,500 by 2015. The resources that can be used are government benefits, subsidies, and grants. Regarding income, schools are banding together to create affordable intra and extracurricular activities, and the communities are trying to create affordable community programs. Community-based approaches, schools are creating intra and extracurricular activities, and the communities are pulling together to provide safe play areas for kids, encourage outdoor play, and encourage team sports.